Good morning, everyone. Today my presentation is about oral FFA, a non-invasive method of fundus fluorescein angiography in children. Fundus fluorescein angiography was discovered by Harold Novotny and David Alves. Ocular fundus photography with the intravenous administration of sodium fluorescein has been widely accepted as the gold standard of investigation till date. However, it has several well-documented side effects. One such being in children, fluorescein angiography can be difficult due to the need for patient cooperation and the difficulty in obtaining intravenous access. To overcome these challenges, an alternative approach involves using oral fluorescein injection, which may also be more suitable for pediatric patients. The studies conducted on adolescents and adults using this method reported only minor side effects and were resolved without any medical intervention. No cases of moderate or severe side effects were documented. My study is a consecutive case series including 10 children satisfying the inclusion criteria done in a tertiary care hospital in eastern India. We've included children of age 10 to 16 years who are follow-ups of retinopathy of prematurity with no other comorbidities, and we've excluded patients with a history of allergy to sodium fluorescein or a severe reaction to any allergen, and patients with moderate to severe asthma, renal failure or significant cardiac disease were also excluded. We've taken informed consent and demographic profile of all the eligible patients along with the detailed history and examination. The weight of the child was assessed and pupils were dilated. 20% fluorescein sodium mixed with 180 ml of apple juice was given orally after calculating the dose to be 7.5 mg per kg body weight. The child was made to sit comfortably, and then a series of photographs were taken using Spectralis HRA using an ultra wide field lens. The timer was started immediately after ingestion of the dye. The actual image capture required was started 3 minutes after dye ingestion, and a photograph was taken at least every 10 to 15 seconds. Any difficulties in adhering to the guidelines were noted, and a physician was available to supervise the procedure and manage any side effects if they arose. Coming to the results, our study included an average age group of 13.5 years and a male is to female ratio of 2:3. And we've attained a mean arterial filling time of about 4 minutes 49 seconds and a mean recirculation time about 13 minutes 56 seconds. This is the arterial filling phase. This is the recirculation phase. No adverse effects were noted in follow-up of up to 48 hours except for mild discoloration of urine and feces. Oral fluorescein angiography has not yet been so popular, but it has a lot of benefits, such as it does not require an intravenous line, which eliminates the challenges of working with uncooperative children or dealing with difficult venous access. There are relatively very minimal adverse reactions noted, unlike the intravenous route, in which they are ranging from mild nausea and itching to rare but severe reactions of anaphylactic shock, etc. It also provides a clear picture of vessel filling, with the disc and macula being well distinguished, which is of a sufficient quality to help detect various retinal vascular abnormalities, especially in children such as retinopathy of prematurity, cholestasis, etc. The time of and success in obtaining images of early arterial phase and recirculation phase were comparable with published studies. We also have some limitations regarding our study, which is that it is a small study group, it is time taking, it is of lower image detail when compared, and early phase of choroidal flush couldn't be elicited. Although oral fluorescein fundus fluorescein cannot completely replace the conventional method of intravenous route, it is more acceptable for children as an alternative, as it eliminates the need for an intravenous line. It is both efficacious and safe to be used in pediatric age groups. Thank you.
Thank you. It's a good alternative to intravenous fluorescein angiogram. But it would have been nice if you had shown the pictures of pathologies. You have not shown the picture, because definitely the intensity will be less as compared to the intravenous one. But if you had shown those pathologies, it would have been
So
better.
we've done in some pathologies, sir. We've also observed that if they're taking the oral fluorescein on empty stomach, it is giving a greater image quality.
And I'm saying in the presentation, if you had shown the
Sir.
pictures, it would have been better.
Also, it would vary your, GI to choroidal time or GI to retinal time rather would vary depending on the pulse rate of the patient.
Just one or two questions. Yeah. One is that you said it makes it safer, but whenever we do any procedure, we have to have a venous access in place. Supposing the baby collapses and I don't have a venous access, what will I do? So did you take a venous access in these babies, or you did give only oral? Because if they have a reaction, you cannot medico-legally do anything without getting a venous access. So it's a suggestion that, and once a venous access in place, then the question is, might as well do an angiography. So just think about it. Second, what are the, in your experience, when does the dye first appear after taking the orally? And
Sir,
how much time?
So within like 5 minutes, we're able to see the dye,
Yeah.
sir.
Yeah, 5 minutes is given as the classical.
So the anaphylactic reaction will be slower to occur if it is through the GI tract and will normally first manifest as hives and other things.
In
than,
fact, they used to say
but,
that people who may be allergic, an oral angiography could be tried.